Hello, hi everyone. Welcome back to another live session from IILT. I hope you all are doing really good. So I am really happy to come again for another live, and in today's session we are going to see how you can start your role play or how you can have different introductions based on different scenarios. So I'll be taking you through almost all the scenarios, the common scenarios. So it is going to be an interactive session as always. And I'm so grateful for all the suggestions and recommendations, as well as the very lovely messages you guys are posting on our YouTube channel as well as FB page. So I can see many people joining. Hello, hi everyone. I hope you all are doing good. If you could comment the place where you're from, as well as also if you could also comment when you're planning to write the exam, I'll get an idea about how much information I need to give you guys today, okay? So please let me know whether you're planning to write the exam very soon, or if you're a fresher also, please let me know that, because basically today's session is going to be very helpful for those who are a fresher, because I'm going to start from the basics, like how you can open a role play, like how you can start the entire conversation while you're doing the speaking test. So this is basically a basic, kind of like a fresher's pack. Like I'll be telling you how you can start it, how to analyze a scenario, like if it is a noun case or an unknown case. So I'll be taking you through each step by step. All right. Rinsi, hi. Neetu, hi, good evening. Binsi, good evening. Yes, so do tell me in the comment section whether the introductory part is a little bit confusing for you guys, or whether you get stuck or confused about how to move forward or how to start or initiate your conversation, or is it easy for you guys? So let me know. Okay, because then I can help you with more information there. So you could also let me know what area you get stuck, like in which particular scenario is confusing for you. Like in particular case nouns, it might be confusing for you to understand whether it is a noun case or an unknown case. Then you would be confused about how to start. You'll be confused whether you need to introduce your name, whether you need to ask the patient's name. So there is a possibility of many confusions to happen there. So if you have those difficulties, do comment here so that I can understand which areas is a little bit difficult for you guys, and we can have a discussion on that. So Neetu is from Kannur, and you're appearing for the exam on the 18th of this month. All the very best, Neetu Jaws. I wish you all the luck. Do prepare well and let all your wishes come true. Dahlia, hi, good evening. Sharon, hi Sharon. Sonia, hi. Yes, so let me know what is the confusing part for you, like in which particular area it get a little bit confusing for you guys to come to a conclusion about how you can start. Exactly, like whether you need to decide, you have to decide about how you're going to have an opening statement there, right? So let me know whether it is difficult for you to understand or analyze the scenario and then come to a conclusion, when to ask the name of the interlocutor, what name to use, when to confirm the name of the patient, a lot of things. These are very minute details, but yet it can be a little bit confusing sometimes. So I will take you through all those points here, okay? Yes, so I guess we can start right now. So basically, the reason why I chose this topic is because introduction is a very important area in your OET role plays. The reason being because that is when you are leaving an impression, okay? Because you are starting to communicate, and you're showing your ability to initiate a conversation and make the examiner impressed there, or get the attention of the other person, okay? So introduction is very important for two reasons, I would say. The first reason is because you are leaving an impression, as I said, and also you're giving an impression to the examiner that you understood the scenario well. that is the place where the examiner will get an impression, okay, fine, yeah, she's starting in a really good way. That means she understood the scenario. Okay, so you're having a good start. So that means that you're leaving a good impression. The second importance of having a good introduction is it will boost your own confidence. Okay, because when you have a good start, you yourself will feel like, okay, I can do better, or I can do well because I had a good start and the following conversation is also going to be better. So you will have a little more of confidence, okay? On the other hand, touch wood, if you had a bad start, throughout the conversation you will be so focused on that and you'll think like, oh, I had a bad start and it's not going to end well, right? So for these two reasons, according to me, the introduction is very important, okay? So I'm going to take you through a few things that you have to keep in mind, or things that you have to note in an introduction. The first thing is that it has to be very friendly, okay, because you're talking to another person and that person is looking forward to you, seeking help from you. So you need to be talking in a very friendly manner. But at the same time, you have to maintain the professionalism there as well. Do not go very casual with the patient there, okay? So make sure it is friendly. You can always start your introduction with a smile. Always give a smile there, okay? Because I know it is a recorded session and these days, because of the pandemic, you will be wearing a mask as well. But when you smile, that reflects in your tone. And when you talk with a smile on your face, your voice will be also very pleasant. Okay, so always make sure that you're very pleasant and very friendly when you start your introduction. Second thing, you need to sound very welcoming. Okay, do not just go very scripted like, good morning, my name is Richa, I'm one of the registered nurses. Never do that. Don't go scripted. You have to welcome the other person. The other person should feel like, yes, this nurse is the right person to help me. She will understand my points. She will explain everything for me. Okay, so you have to sound welcoming there. So you need to use the right amount of voice modulation, intonation. You have to show that curiosity, okay, like, your voice should have that curiosity, like, how can I help you? When you ask that question also, the patient should feel like, okay, genuinely this nurse needs to help me. So you have to be very welcoming. Sound very confident. It has to be friendly, it has to be welcoming. Thirdly, it has to be very confident, okay, because you have to show that you have the potential and the ability to have a good start or initiate a conversation or kick off a conversation, okay. Show that you have the potential to structure an entire conversation and have a good start there, okay. So you have to sound very confident too. Being a health professional, you are having more power in this situation because you are going to give a lot of medical knowledge or solutions or diagnosis about the particular condition. So you really need to sound more confident. Okay, so but make sure you don't sound rude, but still you need to have a confidence in your voice, like you know what you're talking or you know what you're sharing. Okay, and fourthly, your introduction has to be very smooth. You should not get stuck for even a minute second there, okay, because introduction is somewhere you're actually showing your complete ability to understand the situation and your complete ability to start a smooth conversation. So that sentence has to be perfect. Okay, you can actually pre-plan, like in my last live, I actually did a live about how you can pre-plan few statements and few sessions of your role play. So likewise, introduction is one of the part in that which you can pre-plan, because in today's session I'm going to take you through different situations and different settings, and I'm going to show you how you can introduce yourself, right? So after this session, you guys can also by heart it if you want, or you can understand it and then use your own flexible statements and words to have a good introduction there. So you can pre-plan it, you can learn from this, you can pre-plan it, and you can know, okay, if this is the situation, this is how I'm going to start, or this is how I'm going to introduce, or this is how I'm going to greet the patient, okay? So these are the 4 things that you need to keep in mind, okay? Now, again, when you are going to have an introduction, okay, because when you get the cue card, the first thing we do is that we read the scenario, okay, and in the scenario what you have to do is to have your introduction. I'm just sticking on to the introduction part, I'm not talking about the task area. For the introductory part, you need to understand 5 things, okay. The first thing is, where are you? That means the setting. The setting is important in your introduction because you would be sometimes telling, I'm the registered nurse working in this department. Sometimes you do not have to. Even when you do not have to say the department name, you need to know that it is a ward or whether the patient has spoken to you before. So you need to understand where exactly the conversation is taking place. That is the first thing. The second thing, you need to understand what is your professional role. Okay, sometimes a particular role will be mentioned, like you're a charge nurse or you are the duty nurse, something will be mentioned there. Okay, so otherwise normally we go for the registered nurse. So you really need to understand what is your professional role mentioned there. Third thing, who is your patient? You need to understand who is your patient, what is wrong with your patient. So you need to have an idea about that. Fourth thing, who is the person in front of you? Okay, sometimes you will be talking directly to the patient, sometimes you'll be talking to the bystander, some relative, okay? So you need to know in both cases, if you're talking to the bystander or to the patient directly, in both cases you need to know about your patient, right? So the fourth point is you need to know to whom you're talking to, whether you're talking to a patient or to a bystander. And the last point you need to analyze is that you need to check whether you have met this person before, okay? Because you need to know, is this the very first time you're meeting this person or do you have any sort of previous conversation with this person? So you need to have an idea about that as well. Only then we'll be able to frame our introduction, okay? So these are the 5 points that you need to know while you are reading and analyzing the case note for your opening statement. Okay, you have to understand where you are, what is your professional role, who is your patient, who is the person sitting in front of you, and have you met them before. All right, so these are the 5 things that you need to understand before you start with your role play. So yes, now I will be taking you through different introductory settings. For your better understanding, I have divided the categories into 2 because we do have a lot of settings, okay, n number of settings are there. So we will categorize it into 2, like noun cases and unknown cases. Noun cases are where we already know the patient, we have spoken to them before, or they might have visited the hospital before. And on the other hand, we have the unknown cases where we do not know the patient, okay? Maybe the patient is coming there for the first time. So I have categorized it like that, and I will take you through each category and what are the different settings which comes under each session, okay? So first, we will start with noun cases. All right, yes. Jansi Rani, good evening. I'm really impressed by your videos. She's from Hyderabad. Thank you very much for your kind words, and lovely to see you here, Jansi. I hope you're doing good. All right, guys. So as I mentioned, I'm going to take you through the different points here. So first, we'll start with the noun cases. So could you guys just type in your comment section, what are the normal noun cases that you guys know? Or what are the settings that you can categorize under a noun session or a noun category? Please comment. Or what are the general cases that you can term or categorize under a noun segment? Yes? If it is a, or what are the settings that you would categorize under a noun case? Normally what you do, just let me know. Lizzie said ward, that's correct, okay. Any other particular setting? Ward, definitely, any sort of ward is considered to be a noun case. Any other particular setting that you kind of like take it? Patients in nursing homes, okay. Setu said that. Jomri Jo said hospital ward, again that's correct. Lini Mohan said hospital ward and emergency ward, that's a good point. Shruti said ward, Lizzie said again hospital, CHC, yeah that's correct. On GP, yeah. All right. So you guys clearly have an idea about what would be the noun cases. Lizzie even said recovery. That's also a good point. Okay. So normally we, as you guys said, we categorize ward under the noun case because we know the patient there. The patient is in the ward. We have the details of the patient. Then we can categorize referrals. Okay, when the patient is being referred to you, that means it might be from a different department from the same hospital or from a different doctor. Okay, so referrals can be categorized under non-cases because when someone is being referred, we might have a detail about them. Okay, so it can be categorized under non-cases. Third one is review. Okay, when the patient is coming for a review, kind of like a follow-up, that is coming under a noun case. Then test result, if the patient is coming back for a test result, that can be termed under a noun case. Home visits, if it is kind of like a regular home visit, when you're visiting the patient over and over again on a regular basis, that can be a noun case. And emergency department. Okay, so I have got a question from Neetu Jaws. Is emergency ward noun case? Emergency department is normally a non case, but if in the cue card it is mentioned that the examination is already done. Okay, sometimes it will be clearly mentioned that you have just examined the patient. So if the examination is already done, that means it is a non-case. Okay, because you have already did an examination on the patient, you know what is wrong with the patient. So that can be termed as a non-case even if the setting is given as an emergency department. Okay. So emergency department, it can come under both non as well as unknown cases. Okay, in unknown cases, that means the patient has come there for the first time. We don't have any details, so that is completely a new case. But when the setting is an emergency department and it is mentioned the examination is already done, then it can be termed as a non-case. All right. So these are the common non-case settings that we get. So I'm going to take you through different settings. Like the first one is ward. Before that, I need to tell you one more thing. When you know that it is a non-case, when you know that this is not the very first time I'm talking to this person, or this patient has come here before for a consultation or for a review or something for that matter, okay? You know that this is not the first conversation, there was a previous conversation. You need to know the name of the patient. If it is a non-case, you need to know the name. So many people get confused about how they can get the name. There are three things that you can do. First thing, you can use the interlocutor's name. When you enter the examination room, the interlocutor will greet you with the interlocutor's name. Okay, so if I'm your interlocutor, I would say, hello, welcome, my name is Richard Caroline, you can call me Richard. So if you remember that name, you can call me Richard, you can use that same name in your role plays. Okay, that is the first way. Second way, if you forget the interlocutor's name, no problem, you can ask the interlocutor during the 3 minutes preparation time, what would you prefer to be called in the role play? Okay, you can ask to the interlocutor himself or herself. That is the second way. Third way, if you forgot to ask during the 3-minute preparation time, no worries. You can give a name for the patient. Depending on the gender of the examiner or depending on the character given in the cue card, you can give a name for the patient and the interlocutor will act upon it. Okay, so these are the 3 different ways how you can decide the name. Either you can use the interlocutor's name, or you can ask what would you prefer to be called during the 3 minutes preparation time, or you can come up with a name by yourself. Okay, so these are the 3 different ways about how you can come with a name. So now coming to the first setting, the ward. How can you have an introduction if it is a ward? How do you normally start your introduction? Please let me know. If it is a ward, what do you do actually? If it is a ward, how do you normally start? Let me know. Ward means it is a non-case. We will know the patient's name. So how do you normally start when it is a ward? Anyone? So as I just discussed right now, even it is a ward, you will need to know the name of the patient. So with the name of the patient, how will you start in a ward? So Rima Ben said, good morning, my name is, how are you doing today? Good. Okay. So Martin said, my name is this and I will be the attending nurse today. All right. Anyone else? Anumol said, hi, Mr. or Miss X, my name is. All right. Neetu Jo said, wish the patient's name and introduce ourselves. Lissy said, hello, good morning, I am. All right. Sethu said, how are you feeling today? Good. So I'm happy to see that you guys do have some idea about it. Rekha said, hi, good morning, Alex. How are you doing today? Good. Rekha, I would appreciate you for that sentence, which is absolutely appropriate for the scenario. Lissy said, I will be your attending nurse today. Dahlia, good morning, Mr. X. How are you feeling today? Good morning, Mr. My name is, how are you feeling today? Anu. Lissy, how are you feeling today? All right, yes. So when it is a word or if it is a noun case, it is not necessary that you have to introduce yourself. When you're doing a noun case, your introduction is completely optional. If you want, you can. If you don't do, it is not a crime, okay? Because this is not the first time you're talking to this person, all right? So it is not necessary that you have to introduce yourself when you're doing a noun case too. But you need to know the name of the patient and you need to have a good salutation and a good greeting when you open the statement, okay? So say for example, this is the patient's name is Mr. David. So what you can do is you can start by saying, good morning, Mr. David, how are you feeling today? A simple opening. Good morning, Mr. David, how are you feeling today? This is where I didn't introduce myself. I just directly went in and I just spoke to him like I know him, okay? Because it is a ward and I have been taking care of him. So he's my patient. He knows me. My face is familiar for him. So I just walked in and I said, good morning, Mr. David. How are you feeling today? Okay, that is one way of doing it. Now, if you want to introduce yourself, good, you can do that too. So if you're introducing yourself too, then your introduction will go like, good morning, Mr. David. My name is Richa, one of the registered nurses on duty today. How are you feeling now? Got it? You just need to include your introduction between good morning, David, and how are you feeling today. So basically, you need good morning, David, and how are you feeling today in your word introduction. And if you want to introduce yourself, you can include that introduction in between these two statements. All right? So this is how we normally open a word. Is that clear for everyone? Lini, that is a good sentence. Neetu, yes, that's a good sentence too. Sethu, yes. So that is how you can do this part, okay? You can directly greet the patient using the patient's name and then you can ask how the patient is feeling right now. And if you want, you can introduce yourself too, but if you don't want, you don't have to too, because this is a noun case and as I mentioned a little earlier, the patient will know you by your face. You have been taking care of the patient, right? So it is not necessary you have to, you have to mandatorily introduce yourself there, okay? So that is the what, and if you want, you can specify the, when you're introducing yourself, if you want, you can stress on the ward, the department as well, like, good morning, Mr. David, my name is Richa, one of the registered nurses working in this pulmonary ward. If you want to specify that, you can do that. If not, you can just skip that part and just ask, good morning, Mr. David, how are you feeling today, okay? So that is with the what. The second one I would like to discuss is referrals. Okay, we normally get a lot of referrals, like the general practitioner referred the patient. So to discuss about something, so we do get a lot of referrals. So how will we start for a referral? In a referral, the first way of introduction is you can say, good morning, I'm the registered nurse on duty, you can call me Richa. Okay, because it is a referral, still you know the patient, but the patient might not know you. Okay, because he has been referred by someone to you. So we know the patient, like we might have the case note or some report of him, but it's not necessary he or she might know us. So we have to introduce us to them. Okay, so you have to say, good morning, my name is Richa, or you can say, I'm the registered nurse on duty today, you can call me Richa. Again, do not just follow the same way of introduction everywhere, okay? The common way of introduction is, good morning, my name is Richa, one of the registered nurses. You do not have to always go for the same thing. People always use it. It is because it is very easy to by heart. It is very easy to, deliver. So it is very easy to remember. You can also come up with different ways of introduction. You can say, good morning, I will be taking care of you today. You can call me Richa. Simple as that. Okay, you just need to say your name. You just need to introduce who you are. Okay, you do not have to stick on to the very common or cliche type of introduction there, okay? So if it is a referral, you can say, good morning, I'm the registered nurse on duty. You can call me Richa. You must be Mr. David. You have to confirm it like that, because when it is a referral, you would know the patient has been referred to us by, say for example, a general practitioner. So we will have a history of this patient. We'll have the name and details of the patient too, right? So you're just confirming with this patient, you must be Mr. David. Okay, so that is how you can have an introduction for a referral. Another introduction for a referral can be, if I'm not wrong, you are here as referred by your general practitioner to discuss about your weight management. If I'm not wrong, you are here as referred by your general practitioner to discuss about your weight management. You can even start like that. Okay, so these are the different introductions you can use for referrals. Yes. So Rekha has a question. If the name is given in the role play, we need to call that or else need to ask for the confirmation. If the name is given in the cue card, you can use the name. Again, if the full name is given in the cue card, I would suggest it is always professional to use the surname with the title. Say for example, the patient's name is given as Mr. Henry Paul. Okay, so do not directly call the patient Mr. Henry. You can call the patient Mr. Paul. Always use the surname with the title. Okay, that is one way of doing it. Or you can just confirm it to the patient by saying, I can see that in the report your name is given as Mr. Henry Paul. Is it okay if I call you Henry? You can take a permission like that. Alright? Yes. So the third part I would like to discuss is review. Okay, if it is a review, the patient has come for a review, how would you start? For a review, you can say, good morning, Mr. Peter. Okay, you look much better now. How have you been feeling lately? Good morning, Mr. Peter. You look much better now. How have you been feeling lately? Okay, so in this particular sentence, we are telling Mr. Peter, you look much better than the previous time. How are you feeling now? Okay, so that is how we can start for a review. Or you can start by saying, good morning, Mr. Peter. Are you here for your review? Good morning, Mr. Peter. Are you here for your review? You can confirm that. Okay, so either you can say you look much better. That is a very good sentence you guys should use actually. You are actually greeting the patient and you're actually creating a confidence for the patient by telling you look better now. How are you feeling? Okay, so when the patient is coming for a review, that means the patient might have some sort of improvement, right? So you can say you look much better than previous time. Okay, you can just kind of like encourage the patient or you can appreciate the improvement. So that is a good review opening that you can use. Good morning, Mr. Peter. You look much better now. How have you been feeling lately? That is one way of introducing if it is a review. Or you can say, good morning, Mr. Peter. Are you here for your review? You can go for that statement as well. All right. Then the next one I would like to discuss is test results. If in the cue card it is mentioned that the patient has come to collect a test result, you can start your conversation by saying, good morning, Mr. Sam. Am I right in thinking that you're here for your test result? Am I right in thinking that you are here for your test result? Okay, that is one way of doing it. Good morning, Mr. Sam. Am I right in thinking that you're here for your test result? Again, you're confirming it, okay? Or you can say, good morning, Mr. Sam. Thank you for coming back for your results today. How have you been feeling last week? Or how have you been the last week? Okay, you can say, good morning, Mr. Sam. thanks or thank you for coming back for your results. How have you been this last week? That is also another good thing that you can say. Say for example, in the case note it is mentioned that the patient was asked by the doctor during the previous consultation to undergo a test, and the patient was asked to come back after 2 or 3 days to collect the test. So you are actually telling the patient, good morning Mr. Sam, thank you for coming back for your results. How have you been feeling that last week? We are just checking how are you feeling, okay? So that is another good sentence that you can use. Or you can even start it kind of like an unknown case here too, because it is kind of like the patient is coming for a test result. So if you want, you can normally have a very normal starting too, okay? It is not very necessary you have to take it as a noun case itself. You can say, good morning, my name is Richa, I'm one of the registered nurses working in this hospital. How can I help you today? So the patient is telling, I'm here for my result. Oh, well, yes, could you please help me with your name? Okay, then you can build a conversation from there as well. That is also possible, but I would say it would be really better if you can do it as a noun case, because it is not the first time the patient is visiting you. It might be the second time or more than that. So do not treat it kind of like there is nothing wrong in treating it as an unknown case, but still it would be better if you can treat it as a noun case. Okay, that would be much better in this case. So that is test result. Now, coming to the emergency department, I mentioned emergency department, it can come under noun cases as well as unknown cases. Okay, noun cases as well as unknown cases. And normally when in emergency department, if it is mentioned the examination is already done, okay, then it has to be a noun case, okay, because a patient is there and you will not examine someone whom you don't know, right? So you will be examining that patient and your conversation will be taking place or will start after the examination. So normally it will be by confirming what you found during the examination, okay? So what you can do is you can start by saying, thank you for your cooperation, Mr. Thomas. Thank you for your cooperation, Mr. Thomas. I have finished my examination. I have noticed little bit of redness and swelling on your leg. Okay, so that is what you're kind of like explaining what you found, okay, during the examination, what you found. So you're actually starting by telling the patient a thank you for the cooperation the patient had during the examination. That is where you're starting the conversation, because the examination is already done. So you had an interaction with the patient before where you would be exchanging the names and details there, okay? And this particular case note or this particular conversation is happening after the examination. So you can start by saying, thank you for your cooperation. I have just finished my examination. Based on my examination, I found that you're having a little bit of redness and swelling. That is one way of starting it. Another way of starting it is that you can say, well, Miss Susan, I have closely examined you. Well, Miss Susan, I have closely examined you, and I can confirm the presence of some blisters on your skin. Okay, so if you ask me whether you need to give your name or anything here, you do not have to, because this is a conversation which is taking place soon after the examination. So before the examination, definitely that interaction would have been there. After the examination, again, you do not have to say good morning, my name is this, because already the examination was done there, right? So from the moment the examination is over, you're going to start the next conversation by saying a thank you for the examination or the cooperation the patient had for the examination. So that is how you can start it. Yes, Rika, if I'm not wrong, you're here to collect the test result. Yes, you can use that for the test result one. Setu, please repeat for referral introduction. For referral introduction, I'm just repeating it for Setu Pillai. You can say, if I'm not wrong, are you here as referred by the general practitioner to discuss about your something, any condition there, okay? All right. So that being said, I would also like to point out one more point, that is triage nurse. It is a very rare scenario that you might come across, but it is also possible. Triage nurse settings kind of like very rare, but I have seen 1 or 2 case notes under this case note. Okay, so triage nurse settings will be where the patient would have been first examined by the triage nurse and then referred to you. So in such cases, how will you have an opening statement, or how will you start your conversation? You can say, "Good morning, Mr. Mark. I'm Richa, one of the registered nurses on duty today. I was informed by the triage nurse that you met with an accident and there is a suspected broken leg. For a better clarification, I would like to ask you more details." Okay, so you can say, I'll just repeat that again. "Good morning, Mr. Mark. I'm Richa, one of the registered nurses on duty. I was informed by the triage nurse that you met with an accident and there is a suspected broken leg. For a better clarification, I would like to ask you more details." This is how you can have a very brilliant and smooth introduction if it is a referral from the triage nurse. You can say that the triage nurse passed on some information to you, and for your better understanding, you need to ask few more questions to help him in a better way. So that is how you can have a better introduction if it is a referral case from the triage nurse. Okay, so these are the common non-case scenarios. So under the non-case scenarios, the only thing that you need to keep in mind is that you have to understand this is not the first time you are talking to this patient, or this is not the first time the patient is visiting the hospital. So there would be a history of the patient in the hospital, so it has to be treated like a non-case. Therefore, you need to know the name of the patient. So your introduction is kind of like optional here, but it will not be a big mistake if you introduce yourself too. Okay, if you want, you can. If you don't want, you don't have to. Okay, your introduction is completely optional when it comes to non-case settings, because this is a scenario where the patient is familiar to you. Okay, so you can just follow that. So that being said, let's move on to the unknown cases. So unknown cases are pretty easy because you do not have to be so concerned about how to have an introduction for an unknown case, because that is the place where you don't know the patient, you do not have any information. So it is kind of like a fresh case. It's kind of like a clean slate. You just need to start greeting, then you have to introduce yourself, and then you have to gain the information or gather the information about the patient, and then ask what you can do, and then proceed from there. Still, I'll take you through the different cases that might come under unknown cases. So normally we have the emergency department where the examination is not done. If the emergency department is a setting but the examination is done, that will come under known cases. But here this is an unknown case because the examination is not done. Okay, then we have the community health center, then we have all the clinics like the mental health clinic, suburban clinic, skin clinic, so on, and home visits. Okay, so in normal home visits, you even if it's a non-case, kind of like you're visiting for the first time or you visit the patient multiple times on a regular basis, in both cases you need to know the name, because you cannot visit a person's house without knowing the person's name, right? Even if it's for the first time. So if you're visiting the patient for the first time by a referral from the patient, from the doctor, or to educate the patient for something, then you need to know the name and it will come under the unknown cases. Okay, Dahlia, OPD, local GP, that's right, yeah. Alright, so emergency department, how will you have an opening statement? How will you start your conversation? It is pretty basic, it's very common, and I'm very sure you all will be knowing it too, right? The normal way of doing it is, "Good morning, I'm the registered nurse on duty today. You can call me Richa. You seem to be worried about something. Is everything all right?" Okay. "Good morning, I'm the registered nurse on duty today. You can call me Richa. You seem to be worried about something. Is everything all right?" Okay, so this is the basic introduction that we can have for an emergency department that is an unknown case. Now again, coming to little more detail, if the emergency case or if the case is little serious, Okay, if it is kind of like a life-threatening situation, like the patient is having a bee sting all over the body, or kind of like a third-degree burn, or breathlessness, the patient is unable to breathe while talking to you. So if it is a very severe case, then you do not have to start with the entire story of greeting the patient, telling your name, asking the patient's name. At first, what you have to do is you have to address the concern of the patient and then slowly proceed into the next part. Okay. So in such cases, by understanding the severity of the case, you can have a different start. Okay, you can start by saying, you look like you are in a bad shape. You look like you are in a bad shape. Please be seated. You look like you are in a bad shape. Please be seated. How can I be of help to you today? How can I be of help to you today? This is a very different statement, I would say. Okay, the normal way of introduction, this is something different from the normal way of introduction. So if you want, you can do this. You can say like, you look like you're in a bad shape, please be seated. How can I be of help to you today? Okay, you're showing that concern. When you see the patient is in a very, very difficult situation, or the patient is severely injured, or the patient is completely sick or unwell, and you want to help the patient and understand what the patient is going through, then you can go for this. You look like you're in a bad shape, please be seated. How can I be of help to you today? Then the patient will say what happened to him. After that, you can provide an initial assurance. Oh, I'm really sorry to hear that, but don't worry. You have come to the right place. We will do the needful. But before proceeding further, I will require your name and few details. And from there, you can gather the name, and then you can say who you are. Okay, well, Mr. David, my name is Richa, and I'm the registered nurse on duty today, so I'll be assisting you throughout. Okay, so you can proceed like that too. So depending on the severity of the cases, you need to be logically assigning your statements too. Do not just completely go blindfolded there with your explanations. You have to logically understand what is the scenario, what has to be addressed first, and what is the way you have to interact or initiate the interaction with the patient too. Okay, so that is the emergency department case. Yes, all right. Then community health center. As I mentioned earlier, even if it is a community health center or a clinic, places like or emergency department, the introduction for unknown cases are kind of like similar. You only need to change the settings name. Okay, so now we saw an emergency department opening like, good morning, my name is Richa, one of the registered nurses working in this emergency department, right? Likewise, in community health center, you just need to eliminate emergency department and include community health center. You can say, good morning, my name is Richa, or you can say, I am one of the registered nurses working in this community health center. May I know the reason for your visit? It's pretty much the similar one. Okay, there is no other difference. You just need to make sure that you change the setting name according to that. According to the setting which is given, you have to change that while you're introducing. Okay, so community health center introduction is pretty much similar to the emergency department one. Likewise, when it comes to clinics also, it is kind of like same. Good morning, I'm the registered nurse working in this clinic. Any clinic, okay, skin clinic, or suburban clinic, whatever clinic it is mentioned, you just have to say the name of the clinic, and then you can say, you can call me Richa, and may I know the reason for your visit. It is kind of like similar, pretty much same like community health center and emergency department. Then you have home visit. So home visit is a place where a lot of people have a lot of confusion, okay, because there are a lot of controversies about home visits introduction. I have seen many people using different sort of introduction. What I have to say is that there is no particular script about how you have to start an introduction. Okay, it's totally up to you. There are just basic rules which you need to follow, kind of like some basic logical explanations that you have to address. Besides that, there is no strict script which you need to follow, like this is the only way you have to speak. Again, for a better smooth conversation, it is always better that you have something pre-planned so that you will not get stuck or stammer while doing the role play. So for you to clearly understand and to have a smooth opening, I will take you through, or I'll explain the introduction for home visit, the first time home visit. You are visiting the patient for the first time in their home. Okay, if that's the case, First thing you have to do is you have to confirm is whether this the house is that the patient's house itself. Say for example, our patient is Mr. Hillary. Okay, so the first thing you're going to do is you're going to confirm whether you are at the right place. So you're going to ask, is this Mr. Hillary's house? Okay, is this Mr. Hillary's house? Second thing, you're going to confirm whether you're talking to Mr. Hillary. Okay, so you're going to ask, are you Mr. Hillary? Are you Mr. Hillary? Third thing, once you get the confirmation that you're talking to Mr. Hillary, you're going to introduce yourself. You're going to say, hello Mr. Hillary, my name is Richa. I'm one of the registered nurses from your community health center. Okay, you're going to introduce you, and you have to keep in mind that when you're saying that you're the registered nurse, you have to say you are from the community health center because you traveled from that place to this place. So you have to use from there. Okay, you do not say I'm working in the community health center. I'm the registered nurse from the community health center. After that, you can state the purpose of your visit. After introducing yourself, you can say, I'm here as referred by a general practitioner to assess your progress. Okay, I'm here as referred by your general practitioner to assess your progress. And lastly, you can take permission. Is this the right time to talk? Okay, so I'll take you through that one more time. First thing you're going to do is that you're going to check whether you're at the right place. You're going to see whether you're at the right house. Is this Mr. Hillary's house? Second thing, you're going to confirm whether you're talking to Mr. Hillary. Are you Mr. Hillary? Third thing, you're going to introduce you, who you are, your role, where you're from. Hello, Mr. Hillary. My name is Richa, one of the registered nurses from the community health center. Fourth thing, you're going to state the purpose of your visit, why you are there. You can say, I'm here as advised or referred by the general practitioner to discuss about your progress or to assess your progress. Last thing, take permission. Is this the right time to talk to you? Okay, so you can have a smooth introduction using these 5 steps for the home visit settings, which is for the first time. Okay, like you're visiting the patient for the very first time. So for example, the patient had a recent surgery and you're visiting the patient for the first review, first home visit. Okay, so then you can use the steps. I hope that is clear for you guys. Now, do you guys have any questions about whatever we have discussed so far? If yes, do ask me. Yes. So we have kind of like covered almost different scenarios under the known cases and unknown cases. So if you guys would like to know or ask me any questions about what we have discussed right now, go ahead, please. I would also like to discuss about one more segment, that is how you can have your introduction if it is a bystander in a known case as well as an unknown case. Okay, so before we get into the bystander segment and how to introduce you in how to introduce or start your introduction in that particular segment, I want to know whether you guys are clear or whether you guys have any particular question based on these 2 segments, that is the known cases and the unknown cases. Any questions about it? All right. Okay then. So let's move on to the next segment too. We do have okay, Renchu is saying, ma'am, I'm still not clear about how to recognize known and unknown cases. It is pretty simple, Renchu, because when you read the cue card, if you get an idea like this is not the first time you're talking to this patient, Okay. Normally, if it is a ward, in the setting it is clearly mentioned it is a ward, then you can blindly believe that it is a noun case, okay, because when the patient is being in a ward, that means we have the details of the patient, right? Then if the patient is being referred by someone else to our hospital, okay, or from a different department to our department, that is a noun case because we do have the report of the patient. If the patient is coming for collecting the test result, again, because previously the patient visited us and the patient did a test, so we would have the report of the patient. If the patient is coming for a review, okay, that is a noun case because there was a previous consultation and we would have the history of the patient with us. Home visit, there would be some patients with whom we have to regularly visit them to update their medication or to assess their progress on a repeated basis. That is a noun case. Okay, so basically noun cases means you do have a previous connection or a previous conversation, or do you have a history or a report of the patient handy with you. Unknown cases means you do not have any information. No previous consultation done, no examination done, nothing at all. No previous visit or anything. The patient is come there for the first time, you're meeting him for the first time, and the patient will give you direct information too. Okay? But when you read the case note and if you feel like, okay, there was a previous conversation or a previous consultation which was done, then that is a noun case. Okay? All right. So I would also like to take you through the bystander segment very quickly because we get to talk to the relatives as well sometimes in our role plays, right? So we can again categorize it into noun cases and unknown cases. How you will introduce or have an introduction if it is a noun case and you're talking to the bystander, and if it is an unknown case and you're talking to the bystander. Let's start with a noun case, okay? So if it is a noun case, what you have to do is you have to introduce yourself. The reason being because you're not talking to the patient, you're talking to a relative, so you have to introduce you, okay? That is a third party. A third party may not know you, okay? So you have to start by saying, good morning, my name is Richa, one of the registered nurses working in this department, okay? Are you Susan's mother? You can confirm like that. Are you Susan's mother? Or you can say, you must be Susan's mother. Okay, so that is how you confirm that detail. So she will say, yes, I am her mother. Then you can say, I have been taking care of your daughter, so I'm here to discuss about the improvement of your daughter. Okay, so you can just state the purpose of the meeting, and then she will say, all right. Then before proceeding further, you can say that, for a better conversation, how may I address you? Then you can move forward with your task. Okay, so I'll just show you a recap of that. So it is a noun case. I am walking into the room, the mother is standing there. So what I'm going to do is I'm going to start by saying, good morning, my name is Richa, I'm one of the registered nurses working in this ward. You must be Susan's mother. So she is saying, yes, I am. As a response to that, I'm saying, hi, I have been taking care of your daughter and I'm here to discuss about her improvement. Then you can ask her, for a better conversation, how may I address you? Okay, then she will say, yeah, please call me Susan. Then you can start, all right, Miss Susan. So as per the doctor's consultation or as per the doctor's examination, and then you can move forward from there. So that is how we can have a starting, whether if you're dealing with a non-case scenario and you're talking to the bystander. You can confirm by asking, are you this person's mother? Or are you this person's son? Like that, okay, whatever the relationship is. Now, if you're talking to a bystander and it is a complete unknown case, okay, like the patient is visiting there for the first time, you do not have any history of the patient, okay, then you have to have a very basic introduction like, good morning, my name is Richa, one of the registered nurses working in this emergency department, okay. You seem to be a little upset, is everything all right? So she's saying, no, okay, my son fell down from the stairs and he is hurt. So you can say, I'm really sorry to hear that, but don't worry, you have reached the right place. We will do the needful. Could you please tell me your son's name and age? Okay, because we need the details of the patient, right? So she's telling you, yeah, my son's name is Tom and he's 10 years old. So you're saying, okay, I'll make a note of that. And then again, you can ask, for a better conversation, how may I address you? and then you can use the name of the bystander and then talk. Okay, I'll show you one more recap of it. If it is an unknown case and you're talking to the bystander, you're going to start by introducing yourself. Good morning, my name is Richa, one of the registered nurses working in this emergency department. You seem to be a little worried. Is everything all right? She's saying, no, my son fell down and I'm really worried about it. I'm sorry to hear that, but don't worry, you have reached the right place. We will do the needful. But before proceeding further, could you please help me with your son's name and age? Yeah, my son's name is Tom and he's 10 years old. All right, I'll make a note of that. Could you also please tell me how may I address you? Okay, she's saying you can call me Susan. Well, Miss Susan, could you please give me an idea about what exactly happened? And then you can move forward with your task. So this is how you can deal whether it is, whether if you're talking to a bystander in a known case or an unknown case. Okay, it is pretty easy. You just need to understand the setting and understand the entire scenario, what is taking place or what is happening there. And based on that, you can select your opening statement. Okay. All right. Yes. So by that, we have almost covered the common settings. Okay, do you guys have any questions about what we have discussed today or any other situation? If yes, do let me know, because what I have discussed today is a basic idea and the common topics that might come for the examination, and the common topic where people get confused about as well. There are a lot of other topics as well. Okay, it is not just limited to the points that we have discussed today. It is vast. The scenarios and the settings can be a very vast topic to be discussed. But what I have did today was I concised it and I picked what are the common ones so that it will be a little more easy for you guys to understand. Yes, so if you guys have any questions, do ask me right now, because we do have a few more minutes so we can discuss about that. Sedu, excellent explanation, ma'am. Thank you. I'm happy to know that. Smita, you're welcome, Smita. Yes, again, before leaving, what I need to tell you is that do not get confused about the introduction. It is the pretty basic part. You do not have to be too concerned or worried about how to have your introduction. You just need to, try to analyze this setting in your mind. You just need to picturize it. Okay, give images in your mind like, okay, this is what is happening. I'm standing next to the patient is in the room, so this is the ward. I have the patient details in my hand. I'm walking inside, so it is a known case. So I just need to start by introducing, by greeting the patient. So if you picturize like that in your mind, it is going to be easy. So if, in the case it is mentioned that a mother has brought her child along with her, the child fell down from the stairs and the mother is looking upset, just bring the image in your mind like you're seeing a mother, a worried mother along with a small child, and you're walking close to the mother. So you're seeing her for the first time, so you understand this is an unknown case. I don't know her. I need to ask her what she wants from me. So if you bring or if you create images in your mind, you will understand the setting in a far better way, and it is going to be more clear for you, and you will not get stuck there. You will have a clear idea about it. Okay. Also, I would also like to say that make a list of the common settings and write your introductions down. Okay, learn it, read through the introductions every day. Make sure that you're very familiar with it. Whenever a person asks you, okay, how to introduce in this setting, you should be able to say that like this. Okay, yeah, that's a known case, then you can go like this. Or that's an unknown case, you can go like this. Yeah, that's a home visit for the first time, do like this. So you should be very confident with that. And that will be easy for you guys if you guys know that beforehand. Make a list of it, write it down, okay, and you will know about it. And you will be very familiar. And nobody can, create a mistake, or nobody will go wrong if you know it. If you know what you're talking, then you will not go wrong there. Okay? Yes. Yes, Lissy is asking, repeat emergency unknown case. Emergency unknown case is very easy. You do not know the patient there, so you are introducing yourself. Good morning. My name is Richa. I'm one of the registered nurses working in this emergency department. You seem to be a little worried. Is everything all right? Okay. You do not know the patient there, so you have to greet the patient, introduce, that means you have to say your name, your role and which department you are working, and then you have to ask, how may I help you? Okay, that is how you can do that. Joe Mall, well done ma'am, thank you. Which are the new assurance words we can give the patient? Well, I'm actually planning to do a new video, as well as I'm planning to do a live session for the reassurance, the empathy statements, and few really cool statements that you can use in the role play. So stay tuned, we will be getting back with that, okay? Sonia, thank you. Binsi, well explained, thank you. Thank you very much, Binsi. Yes, so I hope this was helpful for you guys. Manju Soni, hi. Hello Manju Soni. Yes, so I hope this was helpful for you guys. If yes, do let me know, and your suggestions and recommendations are very important and valid for us. So let me know. You can go through the videos which are available on YouTube and FB, and whenever you want to post some suggestion, or if you would like to have a session about one particular topic, you can comment there so that I can get access to it and I can know what is your requirement and come back with a live or another video based on that. So I'll see you guys next time. Until then, take care and happy learning. Bye bye. Good night.